I describe dementia as an inconvenience of sorts. I describe it as an opportunity, actually. I feel blessed that I have an opportunity to turn my life into some service, help to others, and so I have taken this opportunity to do that. And I think it's made it an easier ride. I was diagnosed 8 years ago. So I just think it's an easier ride. And so there's a choice. We make choices every day, when we wake up, how we're going to treat our day. And I choose to treat it helping others, which makes my path easier and also someone else's.
Dementia, formally defined, is any acquired decline in cognitive function that prevents someone from performing activities of daily living. And maybe a simpler way to put it is any change in your memory or other intellectual function that precludes or prevents living independently. The acquired part means that it has to be something that wasn't present from birth. So it's something that you picked up at some point in life. And the impairment in activities of daily living is important because sometimes people do have declines in their brain function or in cognitive function, but they are not so severe as to interfere with independent living. And we don't want to put those people in the same grouping as folks who need help to get by on a daily basis.
When people come to see me, one of the most common questions at the beginning of the conversation, when they know they're being evaluated for the concern of a dementia condition, it's almost within the first few minutes that the family member will ask, is this dementia or is this Alzheimer's disease? And I think that's one of the key educational pieces for people to understand, because dementia is a syndrome and it's an umbrella term. What I mean by that is that when somebody has a memory, thinking, reasoning, speech or language problem, cognition, the word cognition kind of is a term that encompasses short-term memory impairments, speech and language difficulties such as word recall, word understanding of what is written, what is read, essentially reasoning, judgment, being able to multitask. So all those type of issues fall under cognition, and dementia in a terminology standpoint would essentially mean that somebody has a difficulty with cognition, which includes short-term memory.
Alzheimer dementia is the most common form of dementia. The core features of typical Alzheimer dementia are trouble with remembering information. So people with Alzheimer type dementia, because of the way it affects their brain, information comes in, and where it should be stored in the form of memories, it doesn't get stored. And so information that comes in sort of goes missing, and people aren't able to recall it when needed. So the other really common dementias are dementia with Lewy bodies and vascular dementia. So dementia with Lewy bodies is degenerative, like Alzheimer's disease, meaning that there is a disease in the cells of the brain. In this case, it's Lewy bodies that are destroying those cells and causing them to dysfunction. In Lewy body disease, in addition to the cognitive problems, there are also motor problems, mostly exhibiting themselves as looking like Parkinson's disorder, slowness of movement, shaking, and rigidity of muscles. And then a couple of other characteristics of Lewy body disease that distinguish it from Alzheimer's disease are that people with Lewy body disease often have dramatic fluctuations in their levels of attention and alertness. They can go from being just fine to suddenly speaking in a garbled fashion, or falling asleep, or having to take very, very long naps because of that lack of alertness and attention and awareness. And most people with Lewy body disease also have recurrent, well-formed visual hallucinations, meaning they see things that look very realistic. In fact, will often respond as if those things are real, but of course they're not there. Vascular dementia or cerebrovascular cognitive impairment is the second most common form of dementia after Alzheimer's disease. And this occurs when there's damage to the blood vessels that are supplying blood to the brain. That can either be through blockage of a large vessel that occurs suddenly, so a stroke, and if it damages a memory area or language area or another thinking area, that can be an acquired dementia. More commonly, we see damage to many small blood vessels in the brain. Each of the blockages of one of these small blood vessels may not produce very noticeable symptoms, but as they accumulate, the brain becomes less efficient. So you see slowing down of thinking, as well as a host of other brain functions.
Tell your symptoms to the doctors. Go through the tests. And going through the test will probably open your eyes a little bit about what it does, because it is very, very slow. Looking back on mine, I had symptoms probably 5 or 6 years before I was actually diagnosed. But under those times, you always have that ability of saying, oh, well, I've been working too hard. I'm too stressed. And you make up all of these things, because the word dementia, when you talk about, Alzheimer's, Lewy body and all these, there's so many bad connotations with that your mind doesn't want to go there. If you understand what dementia is, you not only help yourself by understanding what's happening to you, what's going to happen to you. It gives you that ability to have as much control as humanly possible for yourself.
I would describe dementia as really our usual way of business, our cognitive thinking and memory abilities, and eventually speech and other parts of us just quite aren't functioning the way we're used to. And this creates the need for a person experiencing these things to have greater needs, and someone to step in the role to fill in some of those blanks. I see dementia sort of as a dance that has to be done with a person living with and a person caring for someone. The biggest misconception I see is either A, people oversimplify possibly what dementia could be, meaning just simple memory loss, or B, people see or only know of the later stages, maybe the end stages, and that's their concept of what dementia could be. And so there's a period of time where there's great independence for someone, they're able to do numerous things, and there's a beautiful period of time to learn new skills and to create new relationships and use creativity to manage this disease. So there's such a misconception of more negative images of dementia, where as we'll talk here later, there are some chances for finding something new in this kind of world of dementia.
I believe that we can, I believe that by ignoring the fact that you feel like you're forgetting too much, or that you do know that someone in your life has dementia and you see traits in yourself, I think that early detection is where it's at. I think we cannot be afraid of what we don't know. And so many times people find out that, hey, it isn't what you think. It isn't dementia, and they can go on their merry way. And for me, it was a really early diagnosis, and I have learned to do many things that help me live life longer, better, And if I had put my head in the sand and not done anything, then I think that I would be much further down a road that I don't want to be. So I think the early detection is so powerful, and don't be afraid of it. Turn around, look at it.
I think a misconception that just because you have a diagnosis of dementia doesn't mean you can't live for many years in a happy state, because people progress at different rates. There's not a one size fits all progression of a patient who has a diagnosis of dementia, and specifically Alzheimer's disease. I've seen people live for 10 years or longer.
I think misconceptions, are that it's always an awful journey, and I think it can be, and I think it turns out that way sometimes. But if we look at each day like that, then it becomes more so. And so, I don't feel great absolutely every day, but what I do is I get up and put a smile on my face and make the best that I can of it. And I find that some days it's much harder than others. And I know other people are in different situations. We're not all walking in the same time, the same place, with the same goings on within or without and around us. So it's different for everybody. So I'm not sitting here saying we all can do that every day, but I am saying that if you have a choice and you can make that choice one that says, yeah, I got an ache and pain in my back and I'm ignoring it. Yeah, I'm a little forgetful and I need to look at it. I think we're better off, and it makes our days easier, and we enjoy life more.
I think a misconception that's important to address is that dementia equals Alzheimer's disease. Alzheimer's disease is the most common cause of dementia, but it's not the only cause. I think that we assume that if someone is developing cognitive trouble or if someone has dementia, that it's Alzheimer's disease. It leads to a lot of confusion, because without knowing the characteristics of the condition that the individual might have. So let's say with Lewy body disease, person might wonder, well, why am I having all this falling? Or why is my movement problematic? Why is there tremor? Why am I hallucinating when my mother who had Alzheimer's disease or my neighbor who has Alzheimer's disease is not having these same experiences? And furthermore, the treatments and the treatment goals are different when you compare Alzheimer to other dementias. So there really is some importance to distinguishing among the different causes, both when it comes to understanding what is going on with the individual now, what that individual is likely or may face in the future, and what we do about what's going on with them, because there are certain treatments that are perfect for Alzheimer's disease, and yet the worst thing that you want to do for Lewy body disease, for example.
I think that the misconceptions and myths about dementia are unbelievable. And there are so many out there that we can't learn, that we can't express our feelings, that we can't be involved in tasks, that we can't talk to other people about what's going on. I remember the first time I talked in front of a group of people. It was here in Nevada. It was at Reno, and it was the National Federal Employees Conference. I think they have it up there every 2 years. And I talked before almost 2,500 people. And so many people came up after and says, well, how can you do that? You have dementia. Well, I just did. And I think that every person, it affects differently, but it doesn't take in the beginning, it doesn't take who you are and what you want to do. And I think you see so many people that start believing that, oh, well, I can't do that. I shouldn't do that. And have other people tell you, you shouldn't do that. Wait a minute. I want to do that. Now let's figure out a way how.
I think also that the misconceptions that it's that we can't talk about it, right? We can't talk about it. I think that's a misconception. I think that it's not a good one. I think we have to become a partner in our own health, and we have to look at it. And I think that talking about it has been a salvation for me. And if anything that I have gone through, I can help others go through, then for some way and something happens, and suddenly you find you've got a new purpose, and you've taken something that isn't so good and made it into something that is helpful to others.
Having dementia does not relegate someone to helplessness or total inability to do anything. We have to be careful when we talk about dementia that we don't talk in global terms when addressing or talking about it in an individual. We really need to think about what that individual's capabilities are, where they need more support, as opposed to sort of this holistic or global term where we think that everyone with any kind of dementia needs the same kind of help. There is not now, there has never been, or will there ever be, a brain identical to yours or mine. And dementia manifests itself in different ways on top of that. So to think that we can describe dementia in global terms across millions of individuals is just foolish. And we might as well just avoid it from the start so that we don't make mistakes that lead to not treating people the way that they need to be treated and helped.
Being an advocate during a physician visit, I think it is absolutely critical to bring somebody that knows you very, very well, that you trust, to give additional information about what they've observed in your daily life over the recent months and years. It's so important that you bring a close family member, friend, and preferably your durable power of attorney to that visit and to all visits in the future, because one of the obvious things that happens is if you're being evaluated for dementia or cognitive disorder, your memory is likely impaired already, and so you won't be able to remember information or the appropriate information from that visit.
You're stepping into somewhat of a new, unfamiliar world, perhaps, uncharted territory. And whenever we start something new, it's always best to kind of start educating yourself on what dementia looks like, what it could present as, and using reliable sources to do that type of educating a person living with and a care partner. And it's very essential at the beginning to realize what's important to you, to try not to step into all of the fear. Seeking out a diagnosis with a well-seasoned professional, I believe, is best, because dementia is very complex. Even in the medical world, it's a very complex diagnosis. And it actually takes time and patience, believe it or not. It's not a simple blood test and boom, we know what you have. So there needs to be a degree of patience and persistence, and using your voice to advocate for what is important. And then once a diagnosis may be given, to learn as much as you can on how you are going to maximize your wellness, and protect your independence and autonomy as much as possible.
Really know and express what your goals are in seeking care. Not everyone wants to be enrolled in a clinical trial, but some people do. Not everyone wants a medication for their condition, but some people do. Not everyone is looking to get assistance at home, but some people are. So being clear both in your mind and with your provider about what your goals are, both in seeking a diagnosis as well as in seeking medical care in general, uh, that's a really, really important aspect of self-advocacy, because then it helps you when a provider says, so what questions do you have? If you know what you are seeking, it helps you to be better informed about what questions you might ask, about what might be missing in the provider's explanation to you. Uh, we all enter conversations with assumptions, and providers are no different. They have a sense of what they think patients and their loved ones want to know, but it's going to be different for each person. And we have no way of knowing that if you don't tell us what your goals are. I think the best way to think about medication may be to have a sense of what your goals of treatment would be, and then find out whether medication does actually address any of those goals of treatment. We still don't have anything that stops or reverses the decline. So if that's a goal, medication may not be for you. Or you may readjust your goals once you find out that there is no medicine that does that.
Well, I think that differs with people. Early diagnosis gave me the opportunity to be more aware than people are if they're farther down the pathway of dementia. So with an early diagnosis, I became aware. I listened to people talk about me and say, well, she's high functioning, right? And I thought, whoa, what's that? I listened to a doctor say, well, take this medication and come back in 6 months. I heard people say, hey, you need to go to Alzheimer's Association or Cleveland Clinic and have it checked. I think we have to look, listen, and act and not react. So if we're more cognizant, we can do that. And so I think being aware of what around us, being willing to listen, and fear holds us back so badly. And if we just look around and get to know ourselves, we have to quiet ourselves first, don't we? Because, oh boy, I was busy. I was busy in a senior life, and I was going fast, and I really didn't want to stop that. And I hadn't planned on it. But whatever is presented to you, I think we have to stop and go inside, but listen to all of the divisions around you and make the best call you can make. Because we all have that inner sense if we're quiet enough.
I think what you have to do is, number one, is be honest. Don't sugarcoat what's going on, because the more the doctor knows, the more they can help. And if you go in, and I know most doctors' appointments, they're maybe 6 months apart, maybe a year apart. What would really help is to take and write down whenever you have new symptoms so that you don't forget. Bobby has to go with me because we're very honest with each other. So if we're sitting there and a doctor says, do you have any new symptoms? I would say, well, I think I have this and this. And then Bobby can come in and says, well, he also has this. And that is so important with a doctor, because your care partner sees so much more than you do, because we're kind of looking through blinders, and little things that we don't realize we're doing might be big in your care partner's eyes. If I go in and I'm not telling a doctor that I'm having nightmares and visions and things, he may think that I have one type of dementia when in actuality I have another.
The questions that I think are vital to ask are there things that I can do to reduce my risk, or at least to reduce somewhat of the progression of the condition? Because there are some evidence-based studies and activities that have been shown to be effective. Another important question would be, are there support groups available for people like me so I can ask questions to understand the condition better? what types of educational resources are available.
I think another way to advocate for yourself is to make sure that if things are going in a trajectory that you don't like, that you let the provider know that. Again, we can't read minds. We don't have ways of knowing if some goal that you're trying to achieve is not being achieved, or if we're not moving toward it unless you tell us this.
I think the most important thing too, in being your own advocate, is make sure your doctors know about each other. Make sure that they all work together, because there are certain medications that you can't give people with Lewy body because of the hallucinations. It may work fine with me, but not somebody with Lewy body. Or, vascular has different things that will affect them. Alzheimer's has different things that affect us. So all of your doctors working together is so important, because if you have one that doesn't understand and provides you with some kind of medication, it may activate your symptoms 3 or 4 times as bad as they actually are. So being a self-advocate and being aware of what's happening to you. But you can do wonders with the medical profession if you work with them and make sure that they work for you.
I believe there needs to be a degree, first, of acceptance of where you are. Okay, we're operating in a new way, essentially, with dementia and our ability to communicate. So again, I like to go back to my analogy of the dance with a person living with dementia and a care partner, to go beyond verbal communication. You need to kind of cultivate some savvy skills on reading body language and reading emotions, and then being creative to figure out what's the source of those kind of sticky, rocky points. So I think communication is done in so many different ways in dementia, and you really have to be open to, hey, the way we've always been doing it might not work anymore. And so we're going to come up with other creative outlets, art and music, and again, it's a dance. Who's pushing and who's pulling? We want to work in unison together. And communication is really, truly one of those things to focus on when dementia comes into your world.
So communication strategies are really important. And I like that you phrase it as communication strategies. A strategy is a plan that's thought out beforehand. And a strategy is also not simply a point by point, stepwise process. It is an overall method of responding to a situation, or an overall method of solving a problem. One communication strategy that's useful, I think, in general, is to avoid arguing facts. If someone asks for facts, yes, you should give them those facts. If someone says a fact that's inaccurate, and if that fact has no material benefit or harm, there's not really that much point to correcting it, especially in a situation with dementia where correcting the fact does not lead to greater understanding the next day. The fact is gone. So really standing your ground on facts in most situations is not important. Of course, in situations where it involves necessary care, particularly medical care or safety issues, you do have to stand your ground. But stand your ground in a way that is from the other person's perspective.
Have the person understand where you're at. If I'm talking with somebody for the first time, I would introduce, I have dementia. I'm a pause and things in between words. It's just that my brain is, be very honest with them. And when you talk, then they will understand. They won't sit there and try to put words in your mouth that's not the word you were searching for. And people are good at that if they understand. So you have to, number one is be open to, this is what my issues are. And two, if people start talking too fast, raise your hand. I said, oh, excuse me, could you, just kind of slow down a little bit. I'm having real problems understanding what you're saying. And one of the big things of communication is if you need help, ask for it. Like I have a lot of friends that still communicate and stuff with Zoom. They have a hard time getting on. They ask somebody to help them. And don't be afraid to. And I think the biggest communication is with your family. Be open and honest with them. Sit down and talk with them. Tell them what your fears are. What are you afraid of? Let us help. That's what families normally are for. They're for, they're there to help you get through it.
Thinking about what the other person's needs and wants are and trying to adjust your communication with them on the basis of those needs is really important. If someone hallucinates seeing a man in a corner and is frightened, the fear is not sourced so much by the hallucination itself as it is by what the hallucination could imply. That people can get in here anytime they want, that guy over there might mean me harm. And so what you really want to do is address what their concerns are as opposed to what your concerns are. And sometimes it's hard to tell. The best way to figure it out is to ask. If someone says something that doesn't make sense, it's probably better to not say that doesn't make sense. It might be easier to say, I don't understand what you mean, or I really want to understand you. Can you say it in a different way? Or how do you think we should solve this problem? Or why does that bother you? And start from the basis of the world in which the person with dementia lives, even if it doesn't necessarily coincide very well with your world. Start with that world and work on that basis. And I think you will more likely see a good outcome in each situation.
I think that if we, about communication is key. Communication is everything. It's not easy. So my dad passed in 2002 with Alzheimer's. Nobody communicated with me until I saw his fist in my face. That's not a good deal, is it? And so when I got the diagnosis, I sat back a bit and said, what is it how am I going to handle this? And I certainly didn't want it to be handled the way it was handled with me. So I said, I'm going to bring my kids and grandkids with me on the journey as best I can. And that maybe it's more difficult in the beginning, but it certainly has worked out well in our case. When I have trouble, I will explain it as best I can. And when you hear it, you can repeat it back to me, or you can tell me your feelings if I've stepped on toes, so that we can understand and go hand in hand through this. And as we have done it for the last 8 years, it then makes it easier and an old part of the relationship to keep doing it as time gets on and times get harder.
You can sit down with even youngsters and say, I have something wrong. I might not be around all the time because I have to go in a quiet place. They will understand. And there's, you take all of those guilt feelings of not spending time with them like you should, and you throw them out the window because they understand. Papa has something in his brain that makes him kind of sometimes be grumpy, and they can understand that. and they can work with you. Kids are amazing, their ability to cope. This is so misunderstood by so many people. And I think that everybody tries to, I won't say everybody, a lot of people try to paint all of us with the same brush. Well, he has dementia, that's just dementia stuff. But it's not. Every action is caused by something. Now, the way we react might be due to dementia. That's true. But the act itself is because, are we in pain? Are we afraid? Are we unsure where we're at? And what I like to kind of explain to people, how would you like to be basically abducted, taken someplace you don't know by people that you don't know? You're in a strange place, strange people. And now these people want to come up and they tell you, okay, take your clothes off. We're going to go I'm going to give you a shower. You're going to what? Well, the reaction is probably the same reaction you would have if somebody did that to you. Well, in our minds, somebody is doing that to us.
Behaviors, certainly as a dementia professional, is the thing that families seem to struggle with the most. And again, I see this attempt to continually use the same way of communicating or relating, let's say, to one another to try to solve the problem, or going to medications right away, right? To just hurry up and make it better. But I believe this is so important from the caregiver perspective, that when we're starting to see behaviors, the caregiver needs to kind of maybe be able to step back and trying to piece back, what is that behavior about? You know, is it a lack of sleep? Did we eat the wrong things? Did we have an overstimulating day? Did we do too much?
And I've talked to Bobby about this, and you know, all of the family members know. Because if I can't say anything and somebody sits me on a hard surface, after a few minutes, I'm in pain and I'm going to move. And I don't want that to be seen as acting out, because I'm not acting out. There's a reason for it, because I'm in pain. But they need to know that, because I can't articulate it at that time. And that's what you have to make sure that people understand, that I have this problem, I have this problem, and I have this problem, and be open to the people that are taking care of you. Because I think there's big words and stuff for it, but your actions might be just as much as, maybe you have indigestion, maybe you don't feel good. And if they treat it as being combative, it takes a whole bad road, you know, and you have to communicate what's wrong with you to them through your family. So they need to know.
So with dementia behaviors, we know that changes in mood and behavior in dementia are associated with changes in brain size in certain regions, associated with the accumulation of protein. So we don't want to ascribe behaviors to being completely outside of the disease process itself. But I think the best way to think about it is that dementia and the dementia pathologies in the brain may be predisposed towards expressing oneself in certain ways, but that doesn't mean that it's destiny. And so there are things that we can do in the environment, both the physical environment as well as the interpersonal environment, to reduce those tendencies to behave in certain ways in order to express ourselves. It's particularly important in the interpersonal environment. A person who feels safe, any person who feels safe, is less likely to exhibit anger or irritability or agitation or anxiety or depression than a person who feels unsafe and unmoored. And so that feeling of security and safety, establishing that in as many situations as possible, both when there is nothing going on behaviorally, as well as when an individual with dementia is struggling behaviorally, that's really, really crucial. I can't overstate that. That instead of arguing about whether that man is really there, make sure the person with dementia knows that whether there's a man there or not, I'm here. I'm not going to let that man hurt you. Even though you know it's a hallucination, the key is not to argue them out of the hallucination. In fact, you're guaranteed to fail. The key is to make sure that whatever comes, that that person feels that they are in a safe situation.
For me, I've seen one of the keys to actually living well with dementia is I do believe in an early diagnosis, because I believe that's your opportunity to get it your way. I do love our dementia-friendly friends who have done that and then have seen they're in a new spot in life and then decided that they're going to advocate for themselves and for others, as used it as an opportunity to grow and learn and challenge themselves. I am so inspired by people who have done that and are dementia friendly. Chuck and Nancy are excellent examples of that. I admire too when people go ahead and kind of look at all the fear in the face and do the advanced planning that could go along with what they envision possibly could be the worst case scenario. And it seems like that can shift the anxiety to the present. Now we've done the work of our fears. Do we want long-term care? Do we all these things? And then you can enjoy living in the moment more, and that's where life is lived anyway. So I believe that's a good strategy and approach. Early diagnosis, keeping the company of others, advocating for yourself, using this as an opportunity to grow, whether it be in art or speaking and writing about it. I'm just so inspired by those who have done it that way.
We have to be able to smile. And because some of the things we do, we'll look back and said, did I really do that? Yeah, you did. But you have to be able to accept the fact that, well, I didn't do it. The disease made me do it. And not be really hard on ourselves. I admit, I was one of the worst of being so hard on myself when I would forget a word or try to talk and I couldn't think of the word I was trying to think of. And it just got to the point of, I can't do this. I'm not going to do this. I still want to talk. So I developed Chucky, and Chucky is my little disease. And I've got him right here. He's always right here beside me. It's a little guy like this, and that's my disease. He's been with me for about 27 years. And if I'm having a bad day, I can just tell Bobby that, hey, Chucky's here and he's having a rough day. And we all know. And if I do something wrong, she can say that. And it takes the stress off. It puts it where it belongs. It's not on us. We're not doing things intentionally. We're doing things because the disease is making us do that. We're not initially, intentionally forgetting something. And it puts the emphasis where it is and takes it off of us to get rid of that guilt. And I want everybody to get rid of that guilt because it has no place.
So when somebody has a diagnosis of Alzheimer's disease, there are some people that sort of give up and say there's no hope, and they start off with a no hope attitude. But I've noticed it's interesting because you historically, when people hear a diagnosis of Alzheimer's, they think they're going to die in a few years and they're going to be bedridden in a few years, which often, most of the time, is not the case. And there are definitely ways to live with the condition in a comfortable, meaningful way, and actually do some things to reduce the risk, which a lot of people don't understand, such as simply walking 3 or 4 times a week, 30 minutes at a time, doing some exercise, being socially engaged, making sure their blood pressure is controlled if they have high blood pressure, eating well. There's actually some diets that have been shown to be statistically and evidence-based, essentially proven that they reduce somewhat progression of the disease because they reduce inflammatory agents from a diet, such as sugary food and processed foods. 2 diets being the Mind diet and the Mediterranean diet. And so I think that the diagnosis of this condition has made me aware that, there are people that feel like they've lost the hope, but there's also many people that are motivated to, even though they understand there may not be a cure for this, that they can do something about it.
The way that I keep my well-being, I think, is there is something inside of me that knows about all of this out there, right? It's just a little something that says to me, don't sit there, get up, move. So don't eat that. And I'm very human. I eat a lot of things I should not eat. But I do. And I always say, oh, Nancy. But the deal is we're human and we do it. But I can tell when I do it. So I try to watch what I'm eating, and I try to overcompensate maybe the next day by not doing the same thing. And exercise, I'm good at exercising. I want my body to perform as long as it can. And I realize as the older we get, that it doesn't. But if you stop moving, you got no shot. So I think, and chair exercises are as important as somebody running 6 miles. So I think there's not an excuse for us. And believe me, my back hurts some mornings really bad, and I stretch through those. Not to be a toughie, but to just say, I'm going to feel better at the end of these. And sometimes I'm very gentle with myself because it does hurt. But I just think we have to be cognizant that one of the things with dementia is that you need to be socially active, and you need to get up and move. And I think it is something within you, and it's the people you have around you. I stopped having coffee dates and lunch dates as much as I had walking dates. And I think that's just, or walk to the neighbor, or I take the lollipop around the block. It's just, and run and walk and run and walk with her. I just think you have to plan it. Dementia isn't anything separate. It's something that you take with you. And so it has to go in the plan. And it may stop you from doing as much as you used to do, but to do as much as we can today. I berate myself, and I'm mad at myself, and I say, how come can you do that? And then I take a deep breath. I take a deep breath and I say, wow, what did you do today that was okay? How many things today did you do that excelled or that are okay? And I have learned to pick up the phone and say, I'm really sorry. I didn't mean to do that. I feel like sometimes that's old news, right? But I don't know what else we can do. I mean, to lock ourselves in and never go out again isn't the answer. To, be mad with other people because we're mad with ourselves, which, right, we all do from time to time. I don't know. I think surrounding yourself by people who understand is really a big deal. That's a big deal.
We went to an incident or a viewing downtown at the Van Gogh exhibit, and it was one of the big hotels. We got confused because there's more than one site that has stuff going on. We went to the wrong one. And with people with dementia, okay, that starts the reaction, that your blood pressure goes up, you're getting anxious. We get to the hotel and try to park. The parking machine that you go through is broken. We're sitting there trying to get the little ticket out of it, and it won't come out. So we would go ahead and pull in, and now we got to find somebody to help us with our parking. And it got to the point where we just had to sit down for a minute and just take a breath. Okay, this is what's going on. This is kind of what we need to do. And it really did help, just being very quiet for a minute, getting your bearings. It wasn't catastrophic what was happening, but it was just so stressful at the time. And it just kind of the layers. And people don't understand that everybody has stress in their life. But the normal person that has stress, that stress might be down here to start with, right? Ours are here to start with. So anything can just take us up like this. And sometimes you just have to kind of remove yourself from what's happening, go to a quiet place, sit down, and just kind of regather your thoughts. I know people that always have a little Walkman, I guess they're not iPod, Walkman, I'm dating myself real bad, but the little the iTunes thing, and have music on there. And they can go find a quiet corner, sit and put their earphones in and just kind of get all of everything that's going on, just kind of settle it back down. And once you do that, then, you can breathe again. And that's what we did. We breathed again. We found somebody that could help us and told us exactly what we needed to do, because we were very close of just saying, heck with this, we're going to go home. But we didn't. We found a quiet place. We kind of regrouped. We talked a little bit about what happened, and this is what we need to find out. And then we went and did it. And before we even tried to go home, we found a restaurant and had something to eat in a quiet little corner. And it just kind of allowed us to breathe, to take that minute and say, all right, it's not so catastrophic. We'll get through this. Because you have to adjust sometimes, especially with stress and anxiety. People that don't have any stress or anxiety really have no idea what it's like. I had it so bad at times that I thought my heart was going to explode. It's just, you can feel your blood pressure go up. And thinking about anything rationally is 100% impossible, because your mind is going about warp 9 with all of these things, all these negative things that, this is this and this and that. And it can get you to the point where you can't do anything. And I know there's a few people that we deal with that have taken to support dogs. That is their go-to place. And that is amazing. The reaction that a dog or a little puppy can have on somebody when those things happen. And because you can't live in a world where you don't have those things happening. If you want to be active, if you want to go do things, things are going to go wrong. And you have to prepare for that. If we get stressed or anything, or everything gets too loud, because we had to go through one of the casinos downtown Vegas. And I was amazed at how many people were there. It was packed. So you just have to find a small, quiet place, go sit down and take a breath.
If I'm a person living with dementia and I'm feeling distressed, I think it's good to take pause if you can be, if we can do that, like feeling that frustration. How do we avoid it continuing to grow? So can we use things that we know that make us happy? Our favorite music is a wonderful thing. Getting outside, enjoying nature, enjoying the company of a pet, watching the birds on the bird feeder, doing things that make our brain happy. In brain health, that's really one of the number one things is how do we up that mood with our environment and our lifestyle. So I love to turn to those elements, even when I'm as a caregiver feeling distressed, to be able to, okay, I know I'm feeling frustration and what I'm doing at this moment is not working. So I'm going to kind of redirect my own self with the things that I love. Looking at pictures of things that I know just make me happy.
So anytime you go to places that you want to do things, always have a plan for if things go wrong, to the point of even saying, okay, this has been enough, we have to go home. And that's, you have to understand that that's fine. If that's what needs to happen, then that's what needs to happen. But don't let it not make you want to be involved, not make you want to go out. And if you plan for these things, then I think that is the most important thing about being active and still doing things with your family, is always have that little out that you need if something happens.
One of the most important things that I've learned, and I would consider it a gift from working with people with dementia and their families, is the importance of feelings over fact during communication and just in the general relationship. Someone with dementia is unlikely to recall whether you or they were right in an argument that you had yesterday, but they are likely to recall that yesterday you had a disagreement between you, or that yesterday you were mean or unkind, and that will color the perceptions going forward. So it is more important to be respectful and kind than it is to be right and knowledgeable. The features that are important in relationships, yes, of course, they include common interests, and of course, they include, talking about the news and other things. But the really important features of relationships are the ways in which we communicate information, the ways in which we relate to each other. An exasperated sigh is going to give someone with dementia some kind of feeling that they may not remember exactly why they had that feeling later on. But I guarantee you, the feeling is going to persist longer than the fact will. Even if they admit at that moment, oh, sorry, I shouldn't have bothered you, what they're going to remember is that you get annoyed with them, or you get angry with them, or you're short with them. And it's actually an important thing to learn in all of our relationships, which is why I term it a gift. That, yeah, it's true that when we have better ability to remember and reason, that we're able to come to an understanding of how someone made us feel. We still have the feelings, right? So I think that it's really a gift that Alzheimer's disease and other dementias give us an opportunity to perhaps deepen or strengthen bonds by focusing on how we try to make each other feel, as opposed to focusing on what the actual facts are, what tasks we have to get accomplished today.
Dementia has taught me really um, the evolution of the human spirit in a way. I just really deeper connections with my loved ones, more appreciation for the current moment that I have with people. And I really, dementia has been a tremendous place of growth for me personally.
The gift I have received is the people that I've met and the people that I have had the joy of working with. And knowing that there are so many wonderful people that are doing such amazing things to empower people with dementia is incredible. I think when people understand there are so many people working for us that we're not alone, and there's always somebody there willing to pick you up when you have the right people. When I first had this, I didn't think that I would have the ability to laugh and joke anymore until I sat at a table at an Alzheimer's conference there was 6 people living with dementia and our care partners. And we started telling stories about some of the things that we had done. And everybody was in stitches. We had people asking if they could join our table because they were seeing how happy and joyful we are and what we were talking about and laughing and sharing. And I think that when you are around people that have that mentality, it can't help but wear off. That, you know something, as bad as this is, it's going to be okay. I can still laugh. I can still joke. I can still have fun. I can still learn. I can still love. And by understanding that, one gift of mine has been humor. To be able to laugh and joke about things and the things that happened to me that other people said, would possibly feel, oh my gosh, that is horrible. But I can laugh about it. And it takes all of that mystery and, oh my gosh, and throws it out the door where it belongs. And you have to look for it. It's not going to come and find you. You have to go to find it. But if you do that with an open mind, you'd be amazed at the people that you'll see. And, the people that I met that became friends that now I consider family, that have done and taught me so much.
I think there's many gifts, actually. I mean, I hate to say, and I've said this a lot, I hate to say that I have found joy in a diagnosis such as Alzheimer's. Who's crazy enough to say that? But I do say that. There is something in our humanity that when we help others and make others smile or others see the light, or one day I had someone stop me in the restroom in a restaurant and said, "You are." And I remember when you said, wow, does it get better than that? I think, well, maybe if it wasn't in the restroom, but I think that when we know that we have turned something around in our life, that we find joy in just being able to be present and purposeful, to add dignity and delight to someone's life, wow, that makes my day. And so I just, I'm grateful for where I am today. My dad is always sitting on my shoulder and walking with me, so I'm never alone, along with my grandchildren and my 2 girls. So I got it pretty good. And I turn around and look and I say, oh boy, that person really has the load. Oh, look at there. I don't want to be there either. I'm doing pretty darn good. And I'm glad, to be where I am and be able to do as many things as I can do.